Hey everyone, my name is Srinesh Nandhakumar, and today I will be presenting on the Sri Lankan Civil War, where I'll specifically be covering the post-conflict disparities faced by the Tamil identity. But first, for a quick introduction about myself, I'm currently a rising senior at Solon High School in Cleveland, Ohio, and some of my activities include the American Cancer Society, Speech and Debate, Cleveland Outreach, and the Future Problem Solvers. I'm also currently a research assistant at the Cleveland Clinic. Some of my interests include the biomedical and humanitarian sciences, which I hope to pursue in college. To begin, this presentation will explore the ongoing hardships faced by the ethnic Tamils in Sri Lanka following the end of the civil war in 2009. With a focus on global health, we will examine the mental and physical health disparities affecting the Elam Tamil population. The war began in 1983 after the Liberation Tigers of Tamil Elam, or LTTE for short, attempted to secede from a Sinhalese majority government and form their own sovereign state. After a brutal conflict that killed 100,000 people and cost an estimated $200 billion, the war ended with the defeat of the LTTE. And when considering that the systematic oppression of Elam Tamils through the Sinhalese-led government has resulted in continued poor post-conflict recovery, it becomes imperative that we ask this research question. Are there post-conflict disparities experienced by ethnic Tamils in comparison to the majority Sinhalese population? The answer is a definitive yes. There are clear health disparities between the Sinhalese and the ethnic Tamil minority, specifically physical and mental health disparities. Now, the methodology for this topic was simple. First, I collected a list of research studies involving specific regions in Sri Lanka about topics of my interest. Then, I used census data from these areas and cross-referenced them with the data from these research studies. Then, I was able to effectively provide conclusions about Elam Tamil specifically. In the years following the Civil War, the Sri Lankan government's mismanagement of national policy, particularly in the agricultural sector, has deepened the suffering of Tamil communities already grappling with post-conflict recovery. In April of 2021, the government banned the importation of all chemical fertilizers in a failed attempt to transition to organic farming. This failure had catastrophic consequences for the Tamil population, 70% of whom depend on agriculture as their main livelihood. These communities faced food shortages, job losses, and economic instability at a scale far greater than other regions. By the end of 2022, Tamil families were spending up to 75% of their income on food, forcing millions into poverty and food insecurity. Among these households, 33% of children had to reduce their food quantity. Over half ate lower quality food, and at an extreme, 1 in 10 children skipped meals entirely. Subsequently, among Tamil school children in the northern province, 46% were below the fifth percentile for BMI, and over 40% showcased stunted growth, more than double the national average of 15.5%. This region, where most Tamils live, also had the highest neonatal and maternal mortality rates, and infectious diseases such as tuberculosis occurred at nearly 20 times the national average, reflecting deep disparities in health. Beyond physical health disparities, the Sri Lankan Civil War left profound psychological damage on the Tamil population, particularly in the northern and eastern provinces, home to the vast majority of Sri Lankan Tamils and also the center of the conflict. The government's ban on commemorating LTTE soldiers has deepened this trauma. For example, the top right image is the Kope Cemetery, built for fallen LTTE soldiers. Pictured right below is the Kope Army Base of the 51st Division, built 8 years later on top of that cemetery, an act symbolic of dominance. Mental health data reflects this reality. The northern province, where nearly 94% of Elam Tamils live, reported far higher rates of suicidality, substance abuse, and domestic violence. The prevalence of mental health disorders in this region was over 40%, more than 6 times the national average of 6.1%, highlighting the devastating psychological toll of prolonged conflict and persistent marginalization. In conclusion, over a decade and a half after the end of the war, Elam Tamils continue to face physical and mental health challenges that far exceed national averages. And a clear lack of assistance from the national government makes recovery all the more difficult. Increasing awareness and ultimately addressing these struggles is essential in order for the Tamil community to gain equity within Sri Lanka in the near future. Here are my references, and I would like to thank Mrs. Teresa Pace for her guidance during my research. And I would also like to thank you, the audience, for listening to my presentation. Thank you, and goodbye.